And now, next slide, please. And now I'd like to just give an overview of today's agenda. After welcome remarks, we'll talk more about connectivity and health, scams and fraud, 988 suicide and crisis lifeline. We'll also have a great presentation on access to video calls. After all these presentations, we will have audience Q&A and then our closing remarks. Next slide, please. And now I'd like to introduce our first speaker, Edward Bartholomew, Chief of the Consumer and Governmental Affairs Bureau. Before turning to Ed, I'd like just to share a little bit about his bio, and the bio is included in the slide deck that will be shared at a later date. Ed Bartholomew is the Bureau Chief of the Consumer and Governmental Affairs Bureau, CGB, at the Federal Communications Commission. In this role, he leads CGB's efforts to ensure the Commission meaningfully engages with external stakeholders, including state, local, and tribal governments. He oversees the Bureau's work to implement consumer policies, including those related to disability access. And with that, I'd like to turn it over to Ed.
Thank you, Kayla. Welcome to everyone who's joining us, and thanks for taking the time to be here for today's webinar. The theme of this year's Older Americans Month is championing your health. And at the FCC, we believe that staying connected, and specifically connecting online, can play an important role in maintaining your physical, mental, and emotional health. High-speed internet service can connect you to telehealth resources, family and friends, and a wide range of online communities. And being connected is important. For many of our over 61 million older Americans, social circles shrink, age-related disabilities make it harder to engage with loved ones, and a feeling of being isolated can take hold. Research shows that social isolation can be as bad for your health as smoking 15 cigarettes a day, including an increased risk of heart disease and stroke. It can also lead to depression. Part of our role at the FCC is to ensure that Americans have access to the communications tools they need to stay connected, maintaining social relationships, building new ones, and combating social isolation. This includes our efforts to expand access to high-speed internet services, our work to make communications services accessible for disabilities, and a host of other activities the FCC does to ensure that access to communication service is ubiquitous. Today's webinar is also going to highlight some scams that are targeting older Americans. Scams that often start with a phone call or a text message. Fighting illegal robocalls remains the FCC's top consumer protection priority. And in an effort to make meaningful progress and return trust to calls, we're now focusing on attacking this issue at every stage of a call's life cycle, from origin to call completion. To keep bad actors from ever placing a call, we've kicked off rulemakings that would strengthen our Know Your Customer rules, tighten access to numbering resources, and use fees or bonds to make it more expensive for illegal calls that originate abroad to ever get started. To restore trust in the calls that are made, we've kicked off rulemakings that would improve call authentication standards, deter the use of U.S. area codes when a call originates overseas. And to stop bad traffic as it moves along the call path, we've also kicked off rulemakings that would improve call blocking tools for providers so they can stop suspected bad traffic, that would require blocking of certain types of traffic, and that would ensure all voice service providers at all points in the call path are accountable and actively working to protect consumers from illegal calls. And finally, for the calls that do reach your phone, we're exploring ways to give consumers more accurate and thorough information about the call so that they can determine whether or not it's a call they want to answer. Before turning it back over to Kayla, I want to thank the FCC teams that have helped plan today's webinar and those that are hosting and participating in the webinar. And with that, I'll hand it back over to Kayla. Thank you.
Thank you, Ed. Before I begin, next slide, please. And let's see, we do have some more information about stopping robocalls along the path. This is one of the graphics that we have shared widely with consumers. I'm not going to spend too much time on this because we do have additional information about specific robocalls scams. But I'd just like to point out that this is call along the path and that what the some of the steps that are taken. So very quickly, there's information on this graphic about what before the call origin, and there is additional information about the call transit, which includes stopping the robocalls before they reach consumers, which is something that the FCC is continuously working on. After the call, we do have the enhancing of accountability for callers, which there is strong enforcement actions against bad actors that the FCC is very focused on. And this, again, is really about stopping the scam call before it reaches consumers. Next slide, please. Next slide, please. So now we're going to be talking about connectivity as an ally in championing your health. Next slide. So we're going to be talking a little bit about the benefits of staying connected. We all know that technology has the potential to reduce isolation and benefits for older Americans, and this can be really life-changing. Again, we're really focusing on this month's theme, Champion Your Health. A few examples of how high-speed internet can benefit and help older Americans is getting connected while enabling independent living. And this includes access to life-saving telemedicine and telehealth, staying in touch with loved ones, friends, and family, opportunities for life-changing social engagement, and there are also options for online shopping, for home delivery, for groceries, and other necessities. And all these actions keep older adults, especially those that are homebound, feel like they are participating in everyday life. Next slide, please. We cannot have this conversation without talking about telehealth, telemedicine, and telecare. And these are some of the definitions that we have from an FCC perspective on the topic. Telemedicine can be defined as using telecommunications technologies to support the delivery of all kinds of medical diagnostics and treatment-related services, usually by doctors. An example of this can be when there's inclusion of a diagnostic test where there's close monitoring of a patient's progress after treatment or therapy and facilitating access to specialists that are not necessarily located in the same place as the patient. Telehealth, which is similar to telemedicine, includes a wider variety of remote healthcare services that go beyond the doctor-patient relationship, and it often involves services provided by nurses, pharmacists, or social workers. An example of this can be when a patient is receiving health education that will socially support their medical needs. It could be medication adherence, it could be troubleshooting for health issues for the patients and their caregivers, and many times this does include captioning, interpreting services, and other accessibility services that are available on request. All these ways help the consumer to allow to stay safe, but also address their general needs, which leads to the next point about telecare, which generally does refer to technology that allows consumers to stay safe. And for example, telecare may include consumer-oriented health and fitness apps, sensors, or tools that connect consumers with family members or other caregivers. And it also allows for exercising tracking tools. There are digital medication reminders, and for many, there are early warning and detection technologies available for consumers today. Next slide, please. Staying in touch is really important. It's not only just for older adults, but for all of us. And on this slide here about staying in touch, we do have some statistics. So I'll read quickly through them. Studies show that 1 in 4 adults age 65 or older are socially isolated. And this is information that we have gathered from the National Institute of Aging. 40% of adults age 45 and older experience loneliness. And this is an increase from 35% in 2018. Um, and this information is from a study done by AARP, December of 2025. Social isolation has been linked to serious health risks, including higher rates of depression and anxiety, a weakened immune function, and increased risk of heart disease, stroke, and dementia. There was an article that was published in the Journal of American Medical Associations, or JAMA, that links multiple factors to social isolation, such as living alone, the loss of loved ones, mobility limitations, chronic illness, hearing or vision decline, and reduced transportation access. So, how do we address this or help others, especially older adults, address this? Modern technology offers many solutions that help reduce loneliness and improve well-being through social connections. And using these kind of solutions can open doors to community and essential services. With a call or a click, you can connect with family, friends, and staying engaged. And some of these suggested tools and activity includes video calling platforms and apps that allow you to communicate with family and friends face to face, online classes and virtual communities that provide opportunities for social engagement, virtual volunteering that can really use your skills there while supporting your community, and of course, one of my favorites, online gaming. So online gaming combines the physical activities with online social interaction, and this usually involves some type of exercise. And also, there are some personal companion tools that you can always use. This includes the famous Siri and Alexa, and using audible communications to respond to spoken commands. Next slide, please. So we're going to talk a little bit about accessible connections. On the screen, we have how the FCC champions accessible technology to help older Americans that develop a hearing or vision disability as they age. And we have a few types here. There are 4 that we're just going to briefly mention, but there's so much more. Additional information can be found on our Disability Rights Office website. And at the end of the slide deck, we do have a list of resources for consumers to find additional information. But we'll begin by talking about telecommunications relay service, or TRS. And a good example of this is a caption telephone, where it is used by persons with a hearing disability, but that have some residual hearing. This uses a special telephone that has a text screen to display captions of what other parties to the conversation are saying. And a caption telephone allows the user on one line to speak to the called party and simultaneously listen to the other party, and read captions about what is being said. With closed captioning, this is displaying of the audio portion of a television program as text on the screen, providing critical link to things such as news, entertainment, and informational for individuals who are deaf or hard of hearing. Hearing aid compatibility, a lot of this comes from the Hearing Aid Compatibility Act and other federal laws that require the Federal Communications Commission to ensure the availability of that wireline telephones and wireless handsets are compatible with hearing aids and cochlear implants. When people with hearing aids and cochlear implants use a telephone or a wireless handset that is not hearing aid compatible, they often hear a lot of unwanted noise. So with wireline telephones and wireless handsets that are certified as being hearing aid compatible, it should minimize the unwanted noise and be compatible with the magnetic coils, the telecoils or T-coils in many hearing aids. And the last audio description, which is an audio narrated description of a television program's key visual elements. These descriptions are inserted into natural pauses in the program's dialogue, and audio description makes TV programming more accessible to individuals who are blind or visually impaired. For many adults who need accessible tools, the need can change over time. So, to learn more about the FCC's work in accessibility, we have a web page. Again, Disability Rights Office, but I'll mention it here, fcc.gov/accessibility. Next slide, please. The FCC has its national broadband map. We have a graphic of what the page looks like right here, and it can be reached broadbandmap.gov. So within the national broadband map, there are many things that you as consumers, we can find. So I'm just going to give an overview of some of that information. To help you or your loved ones find out what high-speed internet services may be available in their home, the FCC has created this national broadband map, which allows you as the consumer to search for your address to find out what companies or providers are offering broadband service at your location. And this helps a lot of consumers that they can compare internet access plans to find the most affordable one and sometimes the one that most fits their needs. Next slide, please. So now we come to the next part of our presentation. I did mention about robocalls, scams, and frauds. My colleague Sherry Dawson will be presenting on that. So Sherry, the floor is yours.
Thank you, Kayla. Good afternoon, everyone. I'm Sherry Dawson. I'm Deputy Chief of the Consumer Affairs and Outreach Division, and I thank you for joining us this afternoon. Next slide. We have all heard of frauds and scams. As technology advances, unfortunately, the fraudsters and scammers have advanced their ways of trying to scam consumers, including stealing their hard-earned money. Scams and frauds are becoming so advanced that it is getting harder to recognize them. One of the FCC's main initiatives is stopping illegal robocalls and robotexts that we all get. Most of these calls are from bad actors trying to scam you, and many times it is to gain access to your personal information for their personal gain. Next slide. Our agency's Consumer Complaints and Inquiries Division collect data on the amount of robocalls we receive. Robocall complaints we receive. In April of 2026, the top 5 robocall scams dealt with loans, medical and healthcare, credit cards and debt, false government calls and texts, specifically in April from the IRS and Department of Treasury since that was tax time. And also the last category from false Google listings for advertised businesses. Next slide. As I mentioned before, scams and frauds are getting more difficult to recognize. Illegal robocalls and texts continue to be the preferred tool for starting a scam. There are some basic things we should all look for when we receive calls and texts from people that we don't really know. First, the call will have a threat. There will be a call. The caller will threaten danger or loss of service to you unless you pay them immediately. 2, they'll ask for personal information like your social security number or a previous address to prove your identity. 3, some will offer you a financial assistance or possibly a huge prize or award, but to claim it, you have to give them some of your personal information or pay a small fee to get it. 4, they pose as someone you trust, like a representative from your bank or social services office, and ask for your personal information. And 5, if they do ask you for a payment, they want it in gift cards or cryptocurrency. According to a 2024 Spam and Scam report, Americans lose approximately $25 billion a year through scams and frauds. Next slide. Recently, a lot of the scams have been robocalls or texts about Medicare and health insurance plans, especially targeted for older Americans. The caller will state that they are from a well-known, reliable agency or company to offer you free screenings or discounted medical plans or anything that they think will be a benefit to you. Some will say that they're returning your call about a plan. If you respond that you didn't call them, they'll ask you to verify your identity by giving them some of your personal information like a social security number. It's just another attempt to get that information to scam you for your assets. When you get those types of calls, please hang up immediately. Don't try to engage them in any type of conversation. If the caller says that they are from your Medicare provider, still hang up. Contact your provider using the phone number that you have on your statement or the one that you have in your contacts or address book. Next slide. Another scam being used quite recently is called the grandparent scam. These cons play on your heart by saying that your grandchild or someone else in your family has been in an accident or been arrested or is in some kind of danger. With all the new AI technologies, the caller can even alter their voice to sound like the loved one or friend. They will request or sometimes try to pressure you to pay a certain amount of money to help that person get out of that trouble. Often the caller will also say, don't tell mom or dad about it or don't tell anybody else about it. Although many of us use social media to post pictures and contact friends and family, scammers use that information on the social media platforms to find out who your loved ones are to be able to carry out these scams. Next slide. If you get a call like that, and I know you're scared and anxious, this is what you should do. 1, stop, breathe, don't panic, and try to stay calm. 2, hang up the call. 3, call a relative or trusted family friend and tell them what the caller said so you can verify the truthfulness of the call. 4, contact your local law enforcement, whether it be police department or sheriff's office, to report the call. And 5, report this fraudulent call to the Federal Trade Commission, the FTC, at reportfraud.ftc.gov. Next slide. There are both long and short scams or cons. Recently, there have been an increase in long scams. Those are scams where the fraudster continues to call to create a relationship with you. It can start off as a call seeming to be somewhat innocent or accidental. They'll say, I'm sorry I called the wrong number, but you sound so nice, so let's continue to talk. Once a connection is started and they have your trust, they will ask you for money for a favor or anything that involves you giving them your personal information to handle another type of situation. Next slide. This slide shows the differences between the short con and the long con. The short con may take 1 or 2 calls to do. It may be someone asking you to donate a small amount to a fake charity. It's based on deception and doesn't really involve a lot of planning on their part. They will continue just to call different numbers until they get someone who falls for their scam. The long con involves numerous calls that can go on for a very long time. That is so that the fraudster can gain your trust and your friendship and then ask for a small amount of money. And then they may ask for a larger amount of money or to have you be involved in an investment with them. Next slide. For long cons, the cons can be about business or finance, or business or finance, or could it be about romance or friendship? The bottom line for the scam is to gain a friendship or relationship. They will continue to call you to learn more about you. After a few months, they will let you know about an opportunity to invest or purchase something that will make you a lot of money, but you need to sign up as soon as possible, and you'll have to wire the money or use cryptocurrency. Here are the signs you need to look for to know that it is a scam. 1, there is no paperwork for you to sign, or they can't provide the paperwork for you. 2, they never want to meet you in person or online. You never get to see their face. 3, it's unsolicited contact. 4, the claimant complaint claims that the information that they have is insider information, so you can't even research it yourself. And and 5, there's pressure to act right away, because if you don't act right away, the opportunity is gone. Next slide. There are several dating or meeting sites online, specifically for older adults looking for companionship or friendship. Some older adults have few family or few friends, so this is a way that they can communicate with other people. Unfortunately, the scammer uses that want of companionship and turns it into hurt. If you decide to visit, or if you are active on these sites, be very careful about the information that you provide. Look for signs that this might be a scam. If, for example, the person that you meet on this particular site does not want to meet in person, or they're moving the relationship a lot faster than you'd like for it to be. And then, of course, they don't want you to tell anybody about your friendship or your companionship. I hope you find this information helpful. Please contact us if you want any more information about this, or please ask questions at the end of the presentations. Our next presenter will be my colleague, Dave Savaling.
Thank you, Sherry. My name is Dave Savaling. I'm a consumer education and outreach specialist here with CAOD, and today I'm going to be talking about 988, the National Suicide Prevention Lifeline. Next slide, please. Now, we all know that if you want to reach the fire department, you call 911. If you want to reach the police department or call for an ambulance, you call 911. But the phone number for the National Suicide Prevention Lifeline, which was 1-800-273-8255, was not easy to remember or to recall during a crisis. While the 1-800 number is toll-free, it is not a number most people had committed to memory. Consequently, a lot of calls for emergency mental health care were made to 911, and 911 call centers were not always equipped to handle calls regarding suicidal ideation. For many reasons, it became clear that a new 3-digit telephone code for mental health crises and services was needed. Next slide, please. So, the National Suicide Prevention Lifeline, which is administered by the Substance Abuse and Mental Health Services Administration, or SAMHSA, is now the 988 Suicide and Crisis Lifeline. 988 offers access to care for mental health crises and substance abuse counseling 24 hours a day, 7 days a week. And 988 is as easy to remember as 911. This lifeline may also be reached by text message and by online chat, as well as by the original 1-800 number. Next slide, please. The 988 number for the Suicide and Crisis Lifeline, which the FCC helped establish with SAMHSA, became available nationwide in July of 2022 and is a network of more than 200 state and local crisis contact centers located around the U.S. and its territories. By calling or texting 988, you will be connected to mental health professionals who will provide confidential treatment and consultation. Next slide, please. 988 offers access to a number of services, including access to the Veterans Crisis Line and to services in Spanish language and in American Sign Language. To reach the Suicide and Crisis Lifeline, dial 988 and then press 0 to bypass all the menu options. The Veterans Crisis Line, which is administered by the U.S. Department of Veterans Affairs, offers mental health services to active and former military personnel and their families. To contact them, dial 988 and then choose menu option number 1. And for Spanish language services, dial 988 and then press menu option number 2. All of these options are presented at the beginning of the phone call. For mental health services in American Sign Language, you can text or video phone the number 988 or use the online chat services at the website 988lifeline.org. Next slide, please. Did we miss a slide? Okay. Well, then if that's the case, then I would like to pass the microphone to our colleague, Ike Afobike. He is an attorney advisor in the Disability Rights Office. Ike, the floor is yours.
All right. Thank you, David. Good afternoon to everyone. Thank you for joining us today. I'm going to talk to you about the wonderful world of video calling. We'll go into exactly what video calling is, what it isn't, what accessibility tools you can expect to find when you use it, and what you can do if those tools should be available, but they aren't. So first, can we go to the next slide, please? And one more, please. There we go. Okay. First, what do we mean when we talk about video calls? It sounds pretty obvious, and it kind of is. The term we use at the FCC is Interoperable Video Conferencing Service, or IVCS. And the technical definition is a service that provides real-time video communications, including audio, to enable users to share information of the user's choosing. Basically, that just means any service that allows two or more people to engage in real-time audio-video conversation. So the way I like to think of it is if the platform lets everyone in the conversation see and hear each other at the same time, then it's a video conferencing service. There are some super popular platforms everybody's probably heard of, like Zoom, Microsoft Teams, FaceTime, and WhatsApp. But the rules aren't limited to just those platforms. Kayla talked earlier about telehealth and telemedicine. If you have an online video appointment with your doctor, does that conversation count as a video conference? Well, if the platform is designed to let you and your doctor see and hear each other at the same time, then yeah, it does. Doesn't matter if you're using a popular consumer platform that's unique to your healthcare provider, or some third-party platform. And even though we use the term video conferencing service, it doesn't matter if it's just the two people in the conversation, it still counts. So then what isn't in the video conferencing rules? Well, conversations with non-humans like AI chatbots, that wouldn't count. Neither would video messages, social media posts and comments, even some webinars, depending on if you can see and hear all of the participants in the webinar. So if you want to know if the accessibility options are required to be on the service that you're using, ask yourself if everyone in the conversation would have the ability to see and hear each other. Now, as of September 3rd, 2024, video conferencing services must have accessibility options for people with vision disabilities, hearing disabilities, both hearing and vision disabilities, i.e. people who are deafblind, color blindness, speech disabilities, mobility disabilities, cognitive disabilities, or people who use prosthetic devices. And next slide, please. Video conferencing services are required by law to be accessible to and usable by people with disabilities. And what does that mean? To be accessible, the main functions of the service must be easy to locate, identify, and operate for people with a wide range of abilities. And to be usable, people with disabilities must be able to learn how to operate the service. And that means things like instructions and user guides must also be accessible. The video conferencing companies can decide for themselves which accessibility features they want to provide, but there must be at least one mode to account for almost all of the most common types of disabilities. As you can see in that slide, this means people who, there must be a mode for people that don't have vision or color perception, hearing, people with limited manual dexterity, with limited reach or strength. There has to be a mode that you can use without speech, and a mode for people with limited cognitive skills. So there should also be high contrast modes and both for people with speech mobility or cognitive disabilities. Now, all of those features should be included in video conferencing services right now. And starting on January 12th, 2027, there should be even more accessibility features available, including the ability to expand or minimize specific video windows or customized captioning. So finally, let's talk about what you can do if you have an accessibility issue. First, you might want to reach out to the service provider or the device manufacturer directly. Now, they are aware of their accessibility responsibilities, or at least they should be. But maybe you don't want to contact the service provider or the device manufacturer, and that's definitely understandable. Contact us instead. You can reach the Disability Rights Office at dro@fcc.gov or by phone at 202-418-2517. If you use American Sign Language, you can call our ASL line at 844-432-2275. And if you want to file a complaint, there are 3 paths that you can take. First, you can file a request for dispute assistance or an RDA. Anyone can file a complaint or an RDA by any reasonable means, but we recommend using FCC's online informal complaint filing system, which you can find at www.fcc.gov/accessibility complaints. Now, in an RDA, the FCC works with the requester and the provider to find a solution. And if the RDA isn't resolved within 30 days, the requester can file an informal complaint with the FCC's Enforcement Bureau. Or you can skip the RDA process and just file an informal complaint with DRO. We'll send your complaint to the entity or entities that are responsible, and they normally have 30 days after receiving the complaint to file a response with DRO and with you. And if nothing else works, you can file a formal complaint. But I'll give you fair warning, for a formal complaint, you will probably need to hire a lawyer. And with that, I will pass it over to, I believe, Anthony Butler in the Consumer Affairs and Outreach Division.
Good afternoon, everyone. I'll be reading off a couple of questions, and our speakers will hopefully be able to give you some answers. So far, I see only a couple of questions in the box. The first question is from Lisa Beyer. Can international calls be stopped when they spoof U.S. phone numbers?
Hello, this is Kayla back on screen. So this is something kind of related to call spoofing. If consumers are not aware of what a spoofed call is, it's when the name of an entity that you're familiar with, the scammer, what they do is they take that name, and on your caller ID screen, you might see that the name of that trusted organization. They're spoofing the number. It's made so that it looks a lot like the number that you normally would contact with. Earlier this year, in terms of international calls, the FCC did announce that it was trying to improve customer service via call centers by encouraging the onshoring and strengthening accountability. And we do have more information, which we will when we share the slide. But basically, this is trying to take overseas customer service centers and bringing them back to the U.S. to decrease the amount of illegal robocalls that could be coming from abroad. So that's kind of the information that we're sharing with consumers. But again, when we share the deck, we will also include specific links to this, as this is a very important consumer protection issue for the FCC.
Thank you, Kayla. The next question is from Linda Bove, and it's kind of a 3-part question. First part is, how can telemedicine support deaf and hard of hearing customers? Second part is, how would a physician be able to see deaf customers online without ASL interpreter as access to communications? And the last part is, who is supposed to provide the access online?
Hello, this is Icophobic here. I might be able to help answer that one. One of the best ways for a deaf consumer to be able to communicate with a doctor if they use ASL is through the telecommunications relay service. In particular, they can use what we call video relay service or VRS. There are several companies that provide that service. In essence, they can contact uh, the VRS company and they will assign a communications assistant who is fluent in ASL to act as interpreter during the call. So if you go to our website, uh, there's a quite a lot of information on how to access telecommunications relay services, and there is a list of companies that provide those services that is free of charge to the consumer as well.
Thanks, Ike. Yes, those were the only two questions that we had in our Q&A session. So I think this will conclude, our webinar, and I'll throw it back to Kayla.
Thank you, Anthony. So now we're going to talk a little bit about the resources that the FCC has for consumers to addressing a lot of the issues that were addressed today in the presentations. Next slide, please. We have our Consumer Help Center, which gives consumers an overview and the variety of tools to empower consumers. Yeah, thank you for this. I was about to say, next slide. So what are some of the things that you can find through our Consumer Help Center? These graphics just kind of give you an overview of what the Consumer Help Center provides. Next slide, please. So with this Consumer Help Center, you have a lot of articles on information. There are consumer-focused blurbs that we have. And when you also go to the Consumer Help Center, you also find links to some various information. So through the Consumer Help Center, while our Disability Rights Office also has its own web page, there you can also access it through our Consumer Help Center. The Consumer Help Center also includes our headlines for the Consumer and Governmental Affairs Bureau. So anytime you're looking for a public notice, a consumer advisory, or a news release, or any other type of information that is specific to the Consumer and Governmental Affairs Bureau, you can find that through the Consumer Help Center. The Consumer Help Center also has access to our social media pages. So a lot of consumers always ask us, for example, are you on Facebook? Going to this social media page, you'll see a listing of all the social media platforms where the FCC has its information. We also have a link to our Consumer Inquiries and Complaints Center where consumers can file a complaint or tell us their story about specific issues that they are experiencing. And within the Consumer Inquiries and Complaints Center, there's also a specific area for filing any accessibility complaints through, and there is a specific link for that. Next page, please. So I mentioned the Consumer Inquiries and Complaints Center. So this part, we expand a little bit more on the information. Next slide, please. And again, the Consumer Complaints Center isn't only used to file a complaint. There are articles of information. So if you are thinking about, is my issue something that I can solve, maybe perhaps reading an article that's included there, or should I go on and file a complaint? So on this slide, we have what the icons would be for different type of issues. And once you click on the icon that best identifies the complaint that you would like to submit. There's helpful information and the whole form is available. We suggest you read through it and complete as much information as you have available. And just I'll mention a few things that you can use this for. If you have a issue with some kind of with television, with, for example, a description of the complaints or something related to an emergency, this is where you can find the form for that. Next slide, please. So after a complaint is submitted, you will be provided with a tracking number, which we recommend keeping handy in case you want to follow up on the status of your complaint. You will receive periodic emails about the status of the complaint, and sometimes if the FCC needs more information, a consumer representative will contact you to provide that information. If your complaint is sent to a service provider to help resolve the issue, the service provider is required to respond within 30 days of receiving the complaint, and they are required to send you their response in writing so that you can have that information available. Now, there are times and there are some type of complaints that are not under the purview or jurisdiction of the FCC. And we also do have a web page that lists these types of topics. We work a lot closely with the Federal Trade Commission, so sometimes consumers do advise that they have already submitted a complaint to the Federal Trade Commission about robocalls, but you're welcome to also file them with us. Now, a lot of consumers also do ask us, is submitting a complaint online the only way you can file a complaint with the FCC? And for consumers who may not have access to the internet, we do have our phone number, which is also included in our resource section, but I will mention it here. It's 888-225-5322. Next slide, please. Now we're approaching consumer resources. I will not read through each resource, but I will point out a few that are relevant to the information provided today. Next slide, please. We have a scam glossary that contains a listing of all the scams that the FCC has either written posts about or has consumer advisories or just any scam that we would like consumers to be aware of. Our Consumer Help Center, which we mentioned before, can be reached through fcc.gov/consumers. For any questions today about this presentation, to get more information from the Consumer Affairs and Outreach Division, or if you would like to schedule a presentation or have hard copies of materials that are available online sent to your organization, please email outreach@fcc.gov. And I mentioned before the FCC's call number, 888-225-5322. And for those that need information in American Sign Language, we have the customer support line at 844-432-2275. Next slide, please. And we have a lot of information. I do want to point out that Disabilities Rights Office has a wonderful webpage with a lot of information. And for those that wanted more information about, for example, 988, you can visit the FCC's webpage on the topic. Next slide, please. And with this, I'd like to thank everyone for attending today's webinar. Again, a reminder that if you have any questions that appear for you after this webinar, please send them to outreach@fcc.gov. Thank you for attending today's webinar, and we hope that you can join us at the next one. And with this, I conclude the webinar. Thank you, everyone.